And part of that reality is what we want to discuss this morning. There are some harsh realities with our health we need to take note of as we begin 2024.
I was going to say that.
How much do you know about your body? How much do you know your body needs at this point in time? 2024 needs to be that wake-up call. And on Health Today, we're joined by Dr. Munisola Adanijo. She is lead cardiologist and physician with medical experience spanning 24 years. Now, today we're discussing important health checks for the new year to prevent illness. It's great to have you on the show with us.
It's so good to be here, Titi.
Happy New Year.
Happy New Year.
Okay, so Happy New Year means happy health checks.
Right.
Right? How do we begin? We've just come off a really elaborate holiday. We've eaten all sorts of junk. And now we need to be sure we're going to get through to the next holiday. So what do we do, Doc?
Okay, so it's nice to be here. Happy New Year once again. It's important to do preventive checks.
Okay.
People always like to do this January rush to be healthy.
Okay.
Which is good, which is fine, but it's important to be healthy all throughout the year.
Okay.
But as we're starting a new year, it's good to know what's going on with you, exactly as you said, what's happening in your body. We don't need to wait to fall ill before we check ourselves, because there are so many illnesses that have no symptoms, hypertension, diabetes, some cancers, until something bad happens. And it's really important to do these health checks so that you can catch whatever it is that's happening on time and then treat it early.
Yeah.
To have a higher chance of survival.
Okay, so now we've already started leaning into the scary part of things. We've mentioned diabetes, you've mentioned hypertension, you've even mentioned cancer, the big C word. And there's a whole God forbid thing that comes out. But what are the things I can do this month to be sure that my body is not going through any of these symptoms that I can't see?
So the first thing you need to do is to get your health check done.
Okay.
You need to talk to your doctor. If you have a GP, talk to your GP. Tell your GP, okay, this is my age, these are my family history, this is my family history, these are my risk factors. What health checks can I do? If you have health insurance, talk to your provider, who will tell you, okay, because of your age, your gender, your family history, these are the checks that you need to do.
Okay.
And it's important you go and do them.
Okay.
People always think, oh, doctors always find something.
Okay.
That's not true.
Okay.
If there's nothing there, we won't find anything.
Okay. Which is what we want.
Exactly.
We want the checks to say there's nothing there.
Exactly.
There's that whole thing, oh, I spent so much and there was nothing there. Why did I spend that money?
It's always better for us to check and there's nothing there,
Okay.
than for us not to check and there's something there. Because when it comes to medicine, ignorance is not bliss.
Okay.
And what you don't know can kill you.
So where do I go? I know there are a lot of people watching now that probably haven't visited a doctor in 2 years, probably more. They've probably been self-medicating at home, which is obviously not advisable. But they feel like they're doing okay. So they might not want to go to a hospital. Where can they go? What can they do?
Okay, so there are a lot of centers, that offer these services. A lot of diagnostic centers that offer these services. If you're just walking and you tell them the same thing, age, risk factors, they'll probably tell you the tests that you can do,
Okay.
So that you can check yourself. But it's also important that once you do these checks, a doctor has to help you interpret.
Okay.
Because it's one thing to get the results, it's another thing to know what they mean.
Yeah.
So even though you don't have a doctor currently, and you walk into these centers, and you get your results, you need to take it to your doctor or a doctor that knows what they're doing to interpret them for you.
Okay. So now, you mentioned some things. You mentioned a medical history of the family, not just your personal medical history. Why is the family medical history important?
There's some diseases that run in families.
Okay.
Hypertension runs in families, diabetes runs in families, the big C's, many of them runs in families. So it's good to know. You may not be hypertensive, but your mother or your father may be. You may not have had heart disease, but any of your parents may have had, and it puts you at risk. And that's even the more reason why you need to check.
Okay.
There's some genes that are linked with cancer risk, breast cancer risk, prostate cancer risk. It's important to know the family history so that you can check for specific things in this individual.
But what if you don't have access to this history, or you have the kind of parents that would not even tell you? And maybe the parents don't even want you to be afraid or worried, and they've just never told you that they're even diabetic or they're even hypertensive, or they've had, you know, major issues before. A lot of families are very secretive and, in quote, prayerful, you know. It's not my portion. And even when you go to meet them, you might hit a brick wall. What do you do in that case?
Well, sometimes it's good to be hypervigilant.
Okay.
If you have a parent that died young, you know, or you have maybe your mom uses some kind of medication.
Yeah.
You know, oh, what's this drug for? Or what's that drug for? Even if they don't tell you, and you tell whoever it is that's taking your history, oh, my mom takes XYZ medicine, then the person would know, okay, this medicine is for that. Or my mom was hospitalized for 2 months because of something. So it kind of gives us like an idea as to what the family history may be. And even if you don't know anything about family history at all, it still doesn't matter. You can still, you know, go and do your health checks.
So now, we mentioned earlier on the cost of these checks. A lot of these tests get more and more expensive. Now, a lot of people have, in the end, gone to other places to, you know, do those checks. Doctor, I know you've probably had these conversations with people before. I want you to be as stern as possible with whoever is watching right now and give them a hard, you know, a reality check. These checks. Talk to us, Doc.
So people always say, oh, the tests are expensive. But I like to look at it as a value analysis. It's cheaper to do these tests than to treat illness. Take, for example, a kidney function test. Let's say it's 10,000 naira, give or take. You do it and you catch this, kidney disease early, compared to leaving it and letting it fester and having to do dialysis 3 times a week at 50K per dialysis. So is it really expensive? It's not. The cheapest health checks are free. If you walk into any pharmacy, they can do your blood pressure for you for free and blood sugar for a token. You realize you're hypertensive or diabetic, you start treatment. Compared to waiting and developing a stroke. And then you have to do expensive CT scans, MRIs, and you have to be on admission for months. That's millions of naira. So even though they may not be particularly cheap, you know, they're still cheaper than if you wait to fall sick and then you spend all this money.
Dr. Moni, thank you so much for joining us this morning. Yes, we had to do the hard truths this morning with regards preventing illness this 2024. We want all our viewers happy and healthy throughout the year. That's why we're starting with the hard truths. And Dr. Moni is going to be back again next week. We're going to sort of streamline this series with regards age group and gender for some of these health checks we need to do. And we'll be talking a lot more with you. Use the hashtag WakeUpNigeria on TVC and let us know your thoughts and send in your questions. Thank you so much, Doctor.
Thank you for having me. See you next week.
Yeah, we will be back after this quick break. There's still so much more on Wake Up Nigeria.